How many of you have seen somebody having a heart attack around and not making to the hospital on time? I'm sure a lot of you. And how many of you have seen somebody having a heart attack and probably not identifying it on the time? So that's how our journey started. And I'm gonna confront the world's #1 killer today. So almost 500 million people across the globe continues to be affected by the cardiovascular disease, and every year more than 20 million people die due to heart attacks. How do we actually change in this era where technology is one of the most advanced stage of all time, and how we can actually change people's life who are actually suffering from these life-threatening situations? We all focus on a lot of disease, a lot of reasons why people suffer, and how we can actually change that. Now, especially after the COVID, a lot of you have seen how cardiovascular disease, heart attacks are taking life, and 50% of the people who have heart attack today age under 50, and it's increasing day by day. And in last decade, we have seen about 25% raise in the heart attack cases. Though the technology has matured, the science has matured, and overall there is a decline in the mortality rate when people have it. But if you look at the number of cases, they are going up day by day. Almost, we have seen in last few years, heart attack cases and mortality overall has doubled, and that's what we wanted to change. If you look at the global scenario, we in Asia are the most affected ones who are on high risk and who has the probability of dying prematurely because of heart attack aged between 30 to 70. This problem is so severe, and still we really don't have a solution how we can get people to the hospitals in time. Now, a lot of you have seen there is a concept called golden hour, and when somebody is probably suspect of a heart attack, we should be taking the patient to the hospital immediately. Why so? And how do we even identify that somebody is having a heart attack? How do we know that the suspect or that chest pain is not happening because of a gas? It's not happening because of being under the weather or some other reason. And can we do something about it? Taking it, when we look at the scenario of the healthcare infrastructure at our homes, probably our neighborhood clinics and the emergency systems. So this is how we started looking at, and this journey started with a personal loss. I used to build race cars when I started this, and not trained as a medical expert. But when I started diving into this problem more, I realized this problem can actually be solved. But let's learn what exactly happened when somebody is having heart attack. Heart usually experience more than 200 type of abnormalities. The heart attack which we commonly know happens because of a restriction in the artery. So when you see a clot like this, which restricts the blood flow, people usually experience a severe chest pain. Now, why this 60-minute golden period, why this golden hour is actually the same reason. After the restriction, the artery which is not getting the continuous blood flow damages permanently, and that's what is called a disability to the heart, and that's why the heart's permanent functionality reduces. So what usually doctors does when a patient reaches to the hospital, they simply open that clogged artery and revascularize it, and they make the flow happen smoothly again. So due to this entire episode, if you just look at the presentation time is actually the highest, especially in the Asian countries and the lower and middle income group countries, because when the symptoms happen, from there to the presentation time, when you arrive at the hospital door, then you actually look at door to balloon time. It means hospitals usually measure that how much time a patient is taking after reaching to the hospital door to the final, being on the table or being in the cath lab. In India, 80% of the people are not able to make it to the hospital on time, and this presentation time is actually delayed a lot, and that's why we experience the highest mortality in this segment. So we realize that people are usually running to get an ECG or a basic cardiac test at the last time. It's like running for a charger when you have your phone at just 1%, and if you're not able to make it on the time, imagine what happens to the people and the people around them. And this is actually the race against time, and you lose time, you lose muscle. Time is the muscle here. The basic tool which let people look at the cardiac condition or do the cardiac imaging is called electrocardiography or ECG. Got invented around 125 years ago. The core inventor got a Nobel Prize for it. This is a machine which you see from the gentleman, got developed in 1903, and still this has not reached to the people at the last mile. When I was building the cars, I realized that this particular thing is nothing but a measuring tool, and it should reach to the people. This is the first ECG which you see got popular and has been taken in 1920. And we have evolved with the technology. The ECG became more popular, and I'm sure a lot of us has already heard about it. But how many of you have still seen this happening at homes, or maybe just next door, or to a neighborhood clinic? This has not this has not did a penetration at a larger scale where it needs the most. While this machine has evolved, and you see a ECG machine like this in the hospitals and the ICUs, taking the ECG of a patient when they need it. So our entire work started almost a decade ago, where the idea was very simple: how we take it to the people when they need it the most, and how we do a race against time and win it. So with so many, so few cardiologists, even Google is now tired of diagnosing a chest pain, and that's why we step in the picture. So the entire idea is sparked with the basic thought: can we use a smartphone to diagnose this, or can we bring a clinical grade device helping people using their smartphone at homes? Okay. How many of you know that the computer, what was the capacity and processing power of that computer which make Apollo landing possible on the moon? 4 KB actually. So the smartphone which you have in your pocket is almost 1,000,000 times faster and even more than the chip which actually was involved in that. So my basic idea was, I used to flaunt that computer which I got for the first time, Pentium 4, and that was marketed like that is the fastest computer ever made of that time. And now we have a computer in our pocket which is much more capable than that. Why can't we use it? That's how we discovered the entire idea, and that's how we built the solution on top of it. So ultimately the solution we make, this is one of my learning, is not something which you find in the final shape, but how it actually works, not how it actually looks. Now the idea was very simple: can you actually bring cost of a ECG for less than a cup of tea? And that was actually the basic idea we started with. Can we make ECG as available as a thermometer? We all have a thermometer at home. We all have a blood pressure monitor at home. And now thanks to COVID, we have a pulse oximeter in the addition. You all have a thermometer at home. Do you use it every day? Why? Because the idea is to have it when you need it the most. We all use that tool when that is actually required, and heart attacks usually doesn't knock the door, and that is actually the most fetal condition when somebody is experiencing that situation. So the solution we came up with, it's a simple device which is smaller than your car key, you just plug to a smartphone, and the same amount and quality of the information which you get from a traditional solution inside the ICU, you have it in your phone. So when we developed the tool, we realized half of the problem is solved. And this is not just about getting the data. For a layman, for a non-medical person, ECG trace is nothing more than a Maggie, right? We really don't understand it. Okay, this is the same difference I can do as a non-medical person between a noodle or a ECG trace. So we started looking at the problem more deeply and why the traditional machine has never made it to the clinics around the people even, because we need to solve for the complexity, which we already did for the devices, but how you make people understand that data, and then even if people understand that, how do they act on it? So the device which you see, the form factor, it weighs only 12 grams, works without any battery, it's very similar to a thermometer, doesn't require internet all the time, and you don't need to charge it even, there is no moving part. So you can keep it on the shelf for as long as you want, but the idea is you should have it when you need it the most. And again, when it is a medical device, the idea was how do you achieve the accuracy. This is probably one of the most accurate portable ECG device ever made on the planet, and you get better performance in most of the cases than the traditional ECG machine, that too at a fraction of the cost. So we cut down the the cost of the traditional ECG machine to 1/10, and as I said, cost of per test to less than a cup of tea. When you look at the modern ECG machines now, for the hospital, we realize that in a journey, one solution cannot answer all the problems. And we thought that solution we built, this is so intuitive, so simple to use and so portable. This will probably going to solve problem of the hospitals, the patients at home, the patients who have had a heart attack in past, who are at high risk of getting another heart attack probably, and the clinics around. But we realized that you should have this specific solution for all the categories, and this is where we reimagined again a traditional ECG machine for the hospitals and the clinics. So in the modern solution, we simply illuminated the entire machine and we reimagined the cable, where rather than connecting it with the machine, you plug it to your phone or a tablet, and you do the same level of care which you used to do with a traditional ECG machine. But on top of it, this is now powered by our proprietary AI and the ecosystem, where a doctor who probably don't understand how to interpret an ECG can get in touch with the doctor who is sitting at a higher facility and get the response of a cardiologist within 10 minutes to save that life. Diving a bit more on what exactly ECG means, because nowadays a lot of portable and the wearable devices came into the picture, which gives you an ECG. For diagnosing a heart attack, you have to actually look at your heart from 12 different directions, and this is where you get the complete information about the heart, and in the bottom 6 positions you get maximum information about the clogged arteries and something which you can say damage happened due to heart attack in the arteries. So unless you have this kind of data, you really can't diagnose a heart attack, where you see a most of watches and wearables saying that though we give you the ECG but we don't diagnose a heart attack. And this is the space we play in. When you look at your heart from different directions, you get the different kind of data points, and each and every data point is so sensitive that if you go little far from the heart, you will actually miss that. So the overall technology we built was basically how you look at your heart from all the different angles, and without missing any information, you can actually capture it and make decisions and the clinical outcomes based on that. The AI which we developed, the idea was to make a non-medical person understand whether they need to act, they need a medical attention or not. And the simplest way we found is you just identify the risk stages for them so that they can take action as early as possible. On a smartphone, you see this is how a non-medical person who never got trained on an ECG do the ECG for the first time, get the data, and again identify the risk, and then eventually can take a clinical decision whether they need to see a doctor immediately, whether they can see the doctor after making an appointment, or they are absolutely fine, they can sit home. We kept evolving further because we realized that again, unless the problem is solved from all the different directions, and especially the public health infrastructure, we really can't just sit at one solution, and all of the technology which you see have been evolved over the time. So we built another platform on top of the data. Once we have that strength of the data, now a patient who walks to a primary healthcare center or the community healthcare center in India gets the immediate data plus the response and from an emergency physician or the cardiologist, that how a non-medical person or a paramedic staff sitting at the primary healthcare center without a doctor has to respond, how they have to manage the patient and respect this golden hour period and get the medication to the patient within 60 minutes. So this is how the entire ecosystem we make today. A lot of you must have seen this device. We started with the Shark Tank, and all 5 sharks invested in this technology in first season of Shark Tank. Another good thing happened with us in last few years. Our aim was to build a device for Bharat, especially for the rural India where the penetration of the technology is actually very less. But this is one of the biggest learning which happened for me. When I started this company in 2016, after starting the company after 4 months, I realized, oh, this is called startup. So the biggest dream I had that एक बार your story पे आना है और कभी हम भी $1 million company बनाएंगे. So as a small, if you come from a small town specifically, so we really don't have that kind of capability to think big, because we think because of, we think taking the respect of the resources which we have around, right? Okay, I have this, I can do this much only. We are the most sold ECG in this category globally today. We never sold outside India. We never sold outside India, and 45% of our users are actually sitting overseas. We found this data surprising to us very recently, that why these people are actually buying it. So I went to different places, explored. I realized that now this is not an Indian problem. If you are in the US and you want to go for a cardiac checkup, you have to spend 45 days waiting period just to make an appointment and go and get your ECG done. So now this has further evolved where people need a technology and the entire decentralization is required so that they can take care of their heart. So now we have actually evolved into kind of a Swiss Army knife, which actually is compact, handy and gets the job done. And that's how our journey continues. Today we are saving a life every 10 minutes. The total time spent, time I spent here on this stage today, probably we have saved 2 lives so far. Thank you so much.